Good morning, everyone. KenyaEMR. I'll be taking you through the COVID-19 module in KenyaEMR, which was added last quarter and is already out there at the facilities. Looking at starting with the overall goal of this module, it's helping us monitor the uptake of vaccines among the people living with HIV. Again, it's helping in monitoring the occurrence of COVID-19 among the PLHIVs, as well as in monitoring effect of COVID-19 on appointments and mortality among the people living with HIV. So the focus really of this module is a COVID-19 vaccine uptake among PLHIV who are above 15 years, according to the ministry's guideline. So initially we started, we were at 18, but once the revision was made to include 15 years and above, the same adjustment has been made in the EMR. We are also focusing on getting the history of COVID-19 infections among active people living with HIV/AIDS, regardless of their age. So looking at everyone who is enrolled in HIV care, and if they have been tested and if they have ever tested positive for COVID-19. On Ushauri, we have enhanced the messaging to include COVID-19 messages, just reminding the clients to go and take their vaccinations against the COVID-19. So allow me to just briefly go through the screenshots so that we have an idea of what you'll be seeing in the EMR. I'll be doing a short demo on in the EMR. We have been able to have a built-in form for which we have labeled as COVID-19 assessment form in KenyaEMR, which we can access through various apps on the homepage, the Charge, the Clinician, the COVID-19. Then we have a client who is very new or a client who is already enrolled in HIV care, but they have never been assessed for COVID-19 vaccinations. You can see we have alerts on eligible and all that. So we'll be able to see this live on the system. So I'll just go through this briefly. So for a client who has maybe a sample of the form is shown and the variables that are there, we'll be able to fill this together. Then we have a client who has maybe been partially vaccinated and they're coming back for a subsequent visit. Then you'll be able to see part of the history and then a provision for you to update the data for the current visit. A client who has been fully vaccinated, we have an alert just flagging the clinician, letting them know that this client has already received their full vaccination, and maybe now what they can just document is the booster dose. Then just to help in tracing and documenting clients who maybe missed appointments due to COVID reasons, we enhanced the EMR to include reasons for missing appointment. And we have about 2 reasons specifically for COVID-19, which you'll be able to see in the EMR. Then for clients who passed on or died due to COVID-19 complications, again, we enhanced the discontinuation form to include the COVID-19 complication. And again, we'll see how we document that in the EMR. We have a report with a number of variables and indicators that we are focusing on. We'll be able to go through the indicators one by one when we're in the EMR. And also we have a dashboard for the same. So that's just a snapshot of what we have in the EMR. So if you allow me, I would want to just share a different screen so that we do a short live demo of the module. So confirm that you can see KenyaEMR homepage.
Yes, we can see.
All right, thank you. So I'll be using a client who is already enrolled in the facility and who is already on a current visit, just to save on time. So we have our client who is called Eunice, Europe. So once you have a client, you have already checked in for an active visit, then the next thing would be to access the COVID assessment form. And we said we can access it differently, either via Traj, you'll be able to see the COVID-19 assessment form. Also, a clinician, under the clinician app, you'll be able to see the same. The COVID-19 assessment form is still accessible from there. And also we have an app specifically for COVID-19. And on this, you're able to see first the history, if the client has received any vaccination and all that. And then you can access the COVID-19 assessment form. So this is just helping people to access this from different points. Because at times it will be filled at the Traj, it can be filled by the clinician, or anyone who wants to access this. They have those three sections where they can access it from. So to update this, just click on the form. Then we have the encounter date. I had already done a check-in, backdated one, so that we just see what happens on subsequent visit. And then we have the first variable that we're looking at, which is if the client has ever been vaccinated. So maybe before even I continue, for clients who are below 15 years, who are not eligible for vaccination, then this question won't be there, and they will only have the diagnosis and management section. So that's the difference between the under 15 and the over 15. So if you say that the client has ever been vaccinated, that is when you access the section for vaccines. So we have all these listed, and if there is any other, you just pick. So allow me to use AstraZeneca. And assuming our client was vaccinated last, let's say 15th September, if it has been verified, looking at maybe they got an MOH SMS that they usually received. So you verify if that was given. So if not, then you just leave it blank, or you just tick for those that you verified. So this client, since we assume that they have just received one dose, we'll say their vaccination status is just partially vaccinated. Then we proceed with the booster dose for those who have received. It's either yes or no. So for now, I'll just say no. But if you say yes, then you can update this. Then moving to diagnosis and management for the client, whether they have ever been tested for COVID-19. If it is a no, then the form will end at that point. But for those who have been tested, then we proceed and check the test results for this client. If negative, again, it ends there. But for a positive client who tested positive for COVID, then we proceed and provide the date. So maybe we can assume maybe they were positive, maybe 15th of November, and we want to know the presentation of COVID-19, whether it was symptomatic or asymptomatic. So if asymptomatic, again, that will end at that point. If symptomatic, we need to know if they were hospitalized or not. So assuming it's no, then the details on the hospitalization will collapse. And then if it is yes, then you proceed and provide more details. So on admission unit, we are giving either the client was on isolation, HDU, or ICU. So you record the highest level that they were hospitalized in. And then we are looking at whether the client received a supplemental oxygen. And if it's either it's a yes or a no, and this form will end at that point. So maybe something I didn't highlight when I started this form is the note on the clients who have not been assessed for vaccination. You'll get these alerts just to trigger or alert the clinician that we need to assess for vaccination of this specific client. So once you fill this, then the next thing is just to save the form by clicking on enter the form. So I can end this visit at this point, and we just see what happens to this client. So if this visit was on 2nd December, so I just want to end it at that point. Sorry, there are issues with the dates. Just allow me to use today's date to clear that. Yeah, so the client came for the first visit, and we filled in first dose for this client. So you see the alert has now been updated from eligible and to partially. So when you come back to the COVID-19 dashboard, you see we have the vaccination history showing you when the client was last vaccinated or when they took their first dose and the vaccine they took and whether the verification was done. So the next thing would be when they are coming back for their next visit, have they received another vaccine or not? So I'll check in again this client, and assuming now on this day they have again received another dose. So if the client has been vaccinated since their last visit, if yes, then we update the other dose. So assuming now they received this in November 15th, and this was verified, then you see the status now has been updated to fully vaccinated. Then I can skip this just for learning purposes, but every visit, the healthcare provider is able to update on diagnosis and management of that client. So we can save this. Sorry, I didn't update this, and then we enter the form. So this will be repetitive for each and every visit. So you see again, the alert has been updated to fully vaccinated for COVID-19. So that's all about the form. But like we saw from the presentation, we had other sections which are more on tracing and having updated the reasons for missing appointment. So you go to patient tracing, and under HIV defaulter tracing information, we have the tracing form. So you'll fill in the date when this client has been traced, whether it was a call or physical or treatment. So assuming this client outcome was contacted, that's when you'll be able to access this section for reasons for missing appointment. And under the reasons, we have these two reasons that were added, whether the client has COVID-19 infection and COVID-19 restrictions. So if any of that, then we'll be able to monitor and know how many of our clients are missing appointment or maybe missed an appointment because of COVID-19 reasons. So this form was enhanced to just allow us to that. So allow me to just discard this since it's just for demo. The other section was on discontinuation form to record deaths due to COVID-19. So on the discontinuation form, let's use today's date as effective, and then the reason, if died, then we have the date of death, the death reason. So from the death reason, we need to capture under HIV disease resulting in other infectious and parasitic diseases. So when you select that under specific cause of death, we have COVID-19 complications. And that's where we should document that to help us track deaths due to COVID-19. And that's it for the discontinuation part. Again, allow me now to save that. On the reports, on the reporting side, we have a report on COVID-19, which is under HIV tab on the reports, COVID-19 report. The procedure for generating this is the same with all the other reports in KenyaEMR. So maybe I can just use 1st November to now, but we already have one that is, we can pick the most recent. So these are the indicators that we're looking for. So we said our eligible population for vaccination is 15 plus. So for this, we are using a test server. So you'll see we have very few numbers. So our eligible population in this database is just 6 clients. And out of those, we have 0 who are partially vaccinated, 2 who are fully vaccinated. And then from that, we have 4 who are not yet vaccinated. So we are able to tell or know how many of our clients are not vaccinated. And by not vaccinated, we are looking at anyone who maybe they have already come to the facility and have confirmed that they have not been vaccinated. And also those who have not yet honored their appointment since the module started being in use in that facility. But to allow the facility just track those who have not been assessed for COVID-19 vaccination, then we have this unknown vaccination status. We are calling it unknown because they haven't made a visit and we do not know whether they are vaccinated or not. So we will only confirm their status once they get to the facility. So the users can use this link just by clicking on the number, get the line list of those who have unknown status, and maybe they can even call them and just request them to come to the facility so that they have their details updated if that is needed. We are able also to see those who have verified first dose, those who have verified second dose, booster dose, and that, all the doses. Then we have those who have ever been infected with COVID-19, can get the line list of the same. Those who have ever been admitted to hospital due to COVID-19, and those who died of COVID-19. So these are the line lists that have been availed for COVID-19 report, and just to help the program track all this and get the data around the same. So apart from the report, we saw a dashboard, COVID-19 dashboard. On the facility dashboard, we have a section that was added on COVID-19. So you see, initially we had up to differentiated care, but now we have an addition of COVID-19 section. And we have one section looking at the COVID-19 vaccination, where we are looking at those who are partially vaccinated, fully vaccinated, and those who have not been vaccinated. On the right, we have the COVID-19 infection chart, where we are also looking at those who have ever been infected, those who have been hospitalized, and those who may have died of COVID-19. So from this, that's all we have on COVID-19 in the EMR. This data is also being uploaded to data warehouse, but I'm sure in our next webinars, we'll be seeing data or analysis based on the COVID-19 data, and you'll be able to have a look at the same. So my urge again is to the partners, the end users at the facility, let's ensure that we update all the data on COVID-19 in the EMR so that we are able to get a complete data set in the National Data Warehouse. Thank you, and back to you, Asia.